Hi, in this video I'm going to explain proton beam therapy in some detail. So a little technical stuff about how it works, who can have it, what cancer tumours it can treat, and a bit about the cost, and maybe a bit about the future of where this cancer treatment is heading. These questions have come from members of the Stage 4 colon cancer group, Facebook group that I'm a member of, so thank you to the members for their questions. So, proton beam therapy is sort of a radiation therapy, but not really. And that's why there's a lot of confusion around it. There's a lot of skepticism around it from oncologists and general doctors as well. There's a lot of hype around it because it costs quite a lot to do, but it also costs a huge amount to set up. So the initial capital investment that a hospital would have to put into make a proton beam therapy centre is incredible. So I'll explain a bit about that. So hopefully this video will clear up some of the confusion and will help you decide if proton beam therapy is something worth looking into. So with cancer there are three main pillars of cancer treatment. Surgery, where you cut out tissue containing cancerous cells. Chemotherapy, which is a family of drugs to attack rapidly dividing cells, of which most cells in the cancer are rapidly dividing. And radiation. Radiation treatment generally refers to photon-based treatments, particularly gamma rays, so X-rays, that kind of thing. Using X-rays to destroy or damage cancer cells. And radiation treatment has a couple of very serious problems which we see as severe side effects, and also the two severe problems limit how and when those gamma ray therapies can be used. The problems are basically when you have a beam of radiation, the intensity of the beam, so sort of its energy, its ability to do work, and in our case damage cancer cells or destroy cancer cells, the intensity drops very, very rapidly with distance of the beam. So when you double the distance, instead of the intensity being half, it's only a quarter. If you were to quadruple the distance, it would be a 16th. Now the problem that causes with cancer treatment is that if you're firing that beam at tumours that are not near the surface of the skin, then most of the intensity of the radiation is going to be in the healthy tissue. So, if you're firing radiation into the liver or whatever, you've got all the healthy, non-cancerous tissue between your skin and the liver, and then a healthy part of the liver, hopefully quite a lot of healthy part of the liver. That's where a lot of the intensity would be. And then there's the less intensity where the tumours actually are, which is obviously the opposite of what you want. And the second problem is called the exit wound problem, and that's that a beam of radiation essentially technically goes on forever. If you shoot a beam of light off into space, it gets weaker and weaker and weaker and weaker and weaker, but it never ends. So you can imagine these gamma rays, these X-rays going into a tumour, destroying cancer cells, damaging cancer cells, but then the beam continues, admittedly at a much lower intensity, through the rest of the body, into the wall or whatever, where hopefully it's contained with a lot of lead shielding. So these two problems. So we see, very unpleasant side effects, obviously famous stuff of your hair falling out, but, grim stuff. Potential of secondary cancers forming, which is, an issue, particularly an issue for younger people. Hopefully they're going to live long, happy lives, so you don't want to do something that's going to cause secondary cancer to form. Now, proton beam therapy doesn't suffer much at all, really, from these two disadvantages. So, proton beam therapy is a very, very accurate therapy that is able to do most of its damaging work in the cancer tumours. So very little damage before the beam reaches the tumour. And then the drop-off in intensity is very, very sharp. So the radiologist or the radiological team planning the treatment will make sure that the drop-off occurs sort of just at the edge of the tumour. So you're getting the maximum damage in the tumour and absolutely minimal damage before and after the tumour. This is fantastic because it allows you to treat a wide range of tumours. So, for example, I have stage 4 colon cancer, spread to my liver. Colon cancer cells are radio resistant, so they're very tough against radiotherapy. You'd need a huge amount of energy to damage them, but you can safely do that with proton beam therapy. Also, because it's so accurate, you can use proton beam therapy to treat cancers in very delicate places. So I believe when it was sort of developed as an actual treatment of cancer tumours, the main focus, if you'll pardon the pun, was head and neck cancers. So things like, well, in fact, the first proton beam treatment centre in the world was in Cambridge in England, and there's a low power, by today's standards, system for treating eye cancers, because you don't want to destroy people's eyes. Obviously, mouth cancers, brain tumours, delicate structures around the neck, around the tongue, that kind of thing, oral cancers. I think in the future there'll be a lot of use for things like maybe ovarian cancer, because if you can very delicately destroy cancer cells that are in a tumour growing on an ovary, you might be able to save the ovary in terms of function, and the patient would still be able to have children, which obviously is fantastic. So that's a bit about how it works. It's damaging cancer cells, and the place where it damages cancer cells can be very, very accurately controlled. It's controlled by the energy of the protons. So you get the protons going at a very high speed. I think like a standard energy level would be 200 mega electron volts, and the protons would be going something like half the speed of light. And you can very accurately deliver where they go. And the way they damage the cancer cells is that as the protons are like come out of the gun or whatever it is at very, very high speed, they basically don't interact much with the atoms in your body because they're going very high speed. And then as they slow down, they interact with the atoms and change those atoms into ions. And that happens very suddenly, and I think it's basically that the more they interact with the atoms, the more they slow down, and the more they then interact with the atoms. It's like virtuous cycle. As they suddenly dump their energy, and those ions damage the cancer cells. I think the way they damage it is double DNA breaks. So if you imagine DNA is like a twisted ladder, the kind of edge part of the ladder gets broken. And cancer cells are very bad at repairing themselves. All cells have mechanisms to repair damaged DNA, but for reasons I don't really understand, cancer cells are very bad at repairing the damage. So then the cell dies, and that takes some time. So, for example, in my case with proton beam therapy, I'm going to have 2 months of treatment. So 5 days a week for 8 weeks, I have these little blasts of proton beam treatment. And during that time, those cancer cells will be damaged and some will die. But the death of the cells kind of continues for a couple of months afterwards. In Japan, where I'm going to have treatment, there's been some really good results with combining NK cell-based immunotherapies with things like proton beam therapy, because when all those large numbers of cancer cells are dying at once, then the immune system can recognize that. So cancer has mechanisms to reduce the suppress the immune system in terms of actually reducing the number of white blood cells made and their activity, and also hiding from the immune system. So part of the immune system is called the immune surveillance system, that uses dendritic cells, which are like these kind of starfish-like cells that kind of float around and find fragments of cancer cells and then present these in your lymph nodes to the NK cells. So dendritic cells are basically finding bad stuff like cancer and presenting it to the other white blood cells, with the strong message that you should go and destroy this. But cancer cells are good at hiding from from your immune system. So there's a very good window of opportunity if you have something that can kill large numbers of cancer cells at once. That's a very good time to be doing immunotherapies where you're boosting the immune system. So in answer to someone asked which organs can be treated, my understanding is a pretty wide range. You can't treat the things like stomach and the colon, because those organs form ulcers, and in the case of the not just the colon, but all of the intestine, you can get bowel perforation. It's like holes in your intestine, which is very, very, very bad. So proton beam therapy can't be used to treat tumours on the stomach, tumours on the intestines. Not really aware of any other places where it can't be used at all. So it's about 25% of the use cases around the world. So 25% of the patients being treated with proton beam therapy, that's for prostate cancer, because prostate is in such a delicate place. In Japan, I think they've treated something like 150 patients with pancreatic cancer, which is one of the absolute toughest cancers to treat, and they're getting very, very good results. I need to be a bit careful about the results, because these results are case studies, not trials, and there's a very, very big difference. Case studies talk about individual patients in a lot of detail. Clinical trials, hopefully, you talk about hundreds and hundreds of patients, all similar, all having the same treatment, preferably with a control group, preferably a double-blind trial, which means the patients don't know if they are in the control group getting the dummy medicine or in the real treatment group, and nor do the staff doing the treatment. That's what double-blind means. The patients and the clinical staff are blind to who's having what in the trial. So what I'm talking about here are case studies. So the evidence is far, 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 far weaker. Far, far, far weaker. So I have stage 4 cancer, which means the cancer spread to distant organs, and so I was diagnosed, I think, about 18 months ago, June of 2016. And in that time I've had surgery and 6 continuous treatments, which is chemotherapy, various molecular targeted therapies. I've had Vectibix, Avastin, and Erbitux, which I'm having now, hence this horrific skin rash. NK cell immunotherapy, that's using white blood cells to attack cancer tumours. Dendritic cell immunotherapy, that's using dendritic cells to try and teach my immune system how to attack cancer. Low-dose dichloroacetate, that's I'm not really sure if you'd say it's a drug. It's kind of drug stroke nutritional supplement that is believed to disrupt the tumour microenvironment, so the cancer tumours have protection around them in the form of lactic acid and other protections, and dichloroacetate stops that forming. I'm using low-dose dichloroacetate, which means I have another drug, long-acting proton pump inhibitor, to destroy the things in the cells that would usually metabolize the dichloroacetate. So I can have a low dose, therefore not get the associated side effect with dichloroacetate, which is peripheral neuropathy, so kind of damage to nerves in your arms and legs if you have it at high doses for long periods of time. Anyway, and also I'm having the 6th treatment that I have is regional hypothermia therapy. So in my case, it's using radio waves to damage the tumours and disrupt the cancer environment to make it hard for the tumours to evolve against my immune system. So I've been having these 6 treatments, and so the reason that I'm a candidate for proton beam therapy is that I've now reached the point where there doesn't seem to be any cancer in the lymph nodes anymore, where it was. There doesn't seem to be cancer spread out throughout my abdomen, where it was, particularly the peritoneum, which is the membrane on the abdomen. And the primary tumour in my colon my sigmoid colon was removed, so the surgeon took 25 centimetres of my colon, which is very unfortunate. I was pretty attached to that. And so now, the reason I'm a candidate for this is that I just have 3 tumours left in the liver, 3 visible tumours, I should say. Originally there were 6. The 6 combination therapies have reduced the largest tumour to half its size and made the 3 smallest tumours essentially go away. They're not visible on scans. And last week I had a PET scan which confirmed this. The other reason I'm a candidate is that I'm getting stable, good results currently from my treatments. I don't know, generally speaking, but in the case of stage 4 colon cancer, if you have proton beam therapy, it's very important that you continue your systemic treatments, your whole body treatments during the time of the proton beam therapy, because it takes 8 weeks. So that's plenty of time for new cancers to be forming. It would be, at least in my case, it would be risky to stop those treatments and just have the proton beam therapy treatment. Because even though it would be destroying the tumours in the liver, that you've still got circulating tumour cells in your blood and this kind of thing. So that's what makes me a candidate. Hopefully, based on some of the things I've said on this video, you will at least be motivated to look into a bit more and see if it's worth asking your oncologist and stuff about it. Be warned, there's a lot of misunderstanding around proton beam therapy. My oncologist who does my chemotherapy, my molecular therapy, he is very, very strongly against me having proton beam therapy. Very, very strongly shouting at me today about it. Because in his mind it's a type of radiation therapy, and there are all the terrible side effects you usually get with radiation therapy. In my case, because I'm having Erbitux as my molecular therapy, the toxicity of that can increase patients with radiotherapy, because radiotherapy generally damages your already damaged immune system a lot. So I think that's why my oncologist is so strongly against it. However, talking to him about some of the points, it was clear he is unfamiliar with it. He is a fantastic gastrointestinal oncologist. However, he's unfamiliar with this therapy. There are so many emerging therapies around, and in the case of proton beam therapy, no good clinical trials, or very few anyway. So oncologists are understandably very skeptical about it. But you should look into it and see if it's worth going to visit a proton beam therapy centre, and they'll generally do a PET scan and then MRI scan of the organ they're going to treat, and come up with a treatment schedule. And then you go for preparation day, which I'm doing this Saturday. In my case, I'm having a type of proton beam therapy called passive scatter proton beam therapy, and that requires like carving a huge block of brass per patient with various holes and things in to kind of guide the beams through to the right places and at the right angles. You also need a custom restraint device, which I think is some kind of straitjacket thing to keep your body as still as possible. When they do the treatment, they put a sensor on your chest to measure the breathing, and then the beam is timed with the breathing. So in the case of treating the liver, the beam is only fired when you are breathing out, and it's a certain point in the breath cycle. Human breathing is sinusoidal. Sorry, that's a rubbish sine wave, but you know what a sine wave looks like. So sinusoidal breathing. So proton beam therapy and other similar radiation therapies use a gating technique, it's called, which basically means there's a sensor on the chest so they can time the blast of protons to when the organ will be as still as possible. Some organs don't move much during respiration. Liver moves a lot, so that's a big issue. The costs. So in Japan, healthcare is cheap, even private healthcare. Proton beam therapy in Japan is not available on the standard national insurance. It's classed as something called advanced medical care. Within 5 years, I believe it's going to be freely available on standard insurance. But anyway, so in my case, I don't have private medical care. It is about $26,000 for me. That's like 2 months of treatment as an outpatient. All the preparation stuff, PET scan CT scan to confirm it's working, which they do shortly after they've started. PET scan 3 months after treatment to confirm it's worked. So $26,000. If you're in the UK, the NHS very, very, very occasionally pays for people to have proton beam therapy abroad, generally in the US or Germany, and the cost seems to be about $125,000. That's what the NHS pays. Obviously, if you're living in the UK, you don't pay that. In the US, generally it seems to be $70,000 to $100,000. But prices in the US are very, very variable, and there's a lot of hidden costs in US medicine, or so I'm told by my many American friends. So that's how much it costs. Obviously a huge amount of money, so you're going to want to do your crowdfunding if you're going to be paying for it yourself. I'm going to continue making videos about this, about my going for the preparation day, and obviously when I have the treatment itself, which I'm starting in a couple of weeks' time. So please, you should see like a red subscribe button or something. Please subscribe so you see my videos, and I'll keep you updated. Thank you so much for paying attention for 27 minutes or whatever. And thanks again to all the awesome people in the Stage 4 colon cancer Facebook group. They have taught me so much about cancer. It's incredible. Very, very privileged to be in that group. Whatever you do, join some relevant Facebook groups for your cancer, because they're really good. But best of luck. Hope that you find something that works well for you. And we're now in for the first time in history, it's actually worth talking about cures for stage 4 metastatic cancers of all types, because the progress in the last few years, particularly last year is the game-changing year for cancer treatment. So best of luck. Hope you make it. Cheers.